What if I told you that you could naturally train your body to go multiple rounds in bed without waiting hours in between? Imagine having the stamina and desire to keep going again and again. Today, I'm going to reveal top 5 powerful supplements that not only boost your sex drive, erection quality, but may also make you a multi-orgasmic man, just by using science-backed natural methods. Whether you're in your 20s, 30s, or beyond, it's time to take back control of your sex life and unlock your full potential. So, let's get started. Now, if we talk about multi-orgasm, let's be clear, only a small percentage of men are naturally multi-orgasmic. According to available data, fewer than 10% of men in their 20s and less than 7% in their 30s have this capacity without any intervention. But what exactly makes this phenomenon so rare? And what can science teach us about replicating it? A fascinating study once examined a unique individual who exhibited the ability to achieve multiple orgasms with virtually no refractory period. For those unfamiliar, the refractory period refers to the recovery time a man needs before he can achieve another erection and orgasm. In most men, this period can last anywhere from several minutes to several hours, depending on age, health, and hormonal balance. Remarkably, this particular subject was able to achieve orgasm, remain erect, and continue into the next sexual encounter without interruption. Neurologically, what set him apart was a notable absence of the post-orgasmic surge in prolactin, a hormone that typically increases following ejaculation. Now, elevated prolactin is directly associated with the feeling of fatigue, drowsiness, and decreased sexual desire after climax. In other words, it is one of the primary biochemical reasons most men are unable to perform again immediately. Research shows that in healthy 18-year-old males, the average refractory period is approximately 14 minutes. In contrast, men in their 70s may experience a refractory period extending up to 20 hours. Across all age groups, the average falls somewhere near 25 minutes. This has led to what I refer to as the prolactin theory of male sexual performance. Simply put, if we can reduce prolactin levels, safely and naturally, we may significantly enhance recovery time and sexual vitality. This brings us to an important pharmacological agent known as cabergoline, a dopamine receptor agonist originally developed for treating Parkinson's disease and more commonly used to manage a condition called hyperprolactinemia, or abnormally high levels of prolactin. Anecdotal and clinical reports have consistently shown that men treated with cabergoline often experience a significant increase in libido, erection quality, and in many cases, multi-orgasmic capability. While this data may be considered anecdotal, its consistency is hard to ignore. Bodybuilding communities have also reported similar findings. Athletes using anabolic steroids like trenbolone often experience suppressed libido due to elevated prolactin levels, a common side effect of extreme hormone manipulation. To counteract this, some have turned to cabergoline, and many report not only restored libido, but also an increase in their sexual stamina and frequency of orgasm. However, let me make this very clear. I do not recommend taking cabergoline without medical supervision. It is a prescription drug with a range of potential side effects, including cardiovascular complications and neurological symptoms. It must be reserved for clinically indicated scenarios, not casual or recreational use. Instead, after years of studying endocrinology and sexual health, I sought out natural, evidence-based ways to regulate prolactin and support dopamine levels. Through a combination of literature review and practical application, I developed a supplementation protocol that has yielded significant results. Today, I'm going to share the 5 core supplements from that protocol. Number 1 is L-tyrosine. L-tyrosine is a non-essential amino acid that serves as a direct precursor to dopamine, the neurotransmitter most associated with pleasure, motivation, and sexual arousal. Since prolactin and dopamine are inversely related, increasing dopamine naturally leads to a reduction in prolactin levels. Enhancing dopamine not only improves mood and motivation, but can support a quicker recovery following sexual activity. And if I talk about the dosages, the recommended dosage is 500 to 1,500 milligrams per day. Start with 500 milligrams and increase gradually, and the best time to take them is, on an empty stomach, 30 to 60 minutes before meals. Okay. So number 2 is vitamin E. In a clinical trial involving uremic patients undergoing hemodialysis, those treated with 300 milligrams per day of oral vitamin E showed a significant reduction in serum prolactin levels, from an average of 50.8 nanograms per milliliter to just 15.4 nanograms per milliliter. This antioxidant vitamin also supports vascular health and hormonal balance, both critical for sexual performance. The recommended dosage is 300 to 400 international units per day, typically around 200 to 300 milligrams. Now please note, use only natural vitamin E, that is D-alpha tocopherol, not synthetic DL-alpha tocopherol. Alright. Number 3. Mucuna pruriens. Mucuna pruriens is a natural plant source of L-dopa, the direct precursor to dopamine. It significantly boosts dopamine levels, enhances libido, and reduces prolactin through dopaminergic mechanisms. Clinical trials have shown improvements in sperm quality, testosterone levels, and mood in men with fertility issues. It's also an adaptogen, helping the body cope with stress, which often suppresses libido and performance. The recommended dosage would be 250 to 500 milligrams per day, and is best taken in the morning on an empty stomach. Now, to prevent dopamine receptor downregulation, I'd recommend taking it in cycles, like, for example, 4 to 5 days on, 1 to 2 days off. Okay, so moving towards next. Zinc. Zinc is just amazing. It's an essential mineral with profound effects on male sexual health. It plays a key role in testosterone production and directly inhibits prolactin synthesis. Zinc deficiency is strongly associated with reduced libido, fatigue, and hormonal imbalances. Supplementing with zinc can restore reproductive function and optimize semen quality and sperm count. Take 15 to 30 milligrams per day and don't exceed 40 milligrams daily unless supervised, because excess zinc can interfere with copper absorption. And lastly, we have magnesium, especially magnesium glycinate. Magnesium is crucial for testosterone production. Studies show that magnesium increases free and total testosterone levels, especially in physically active men. It also regulates prolactin secretion and supports dopamine receptor sensitivity, which complements the prolactin-dopamine balance. And did you know, magnesium helps relax smooth muscle tissue, including penile arteries, enhancing blood flow and erection quality. 'Cause erection is all about the flow. It also improves sleep and stress resilience, both vital for hormonal health and libido. The recommended dosage is 200 to 400 milligrams per day. Best taken in the evening, as it may promote restful sleep. If you want to learn more about magnesium and what forms you should take and which ones to avoid, you may want to watch this video that I've linked down in the description. By the way, a bonus tip for you. Combining L-tyrosine, vitamin E, and mucuna pruriens forms a powerful dopamine-enhancing trio, helping reduce the refractory period and boosting sex drive naturally. Remember, you don't have to settle for one and done. With the right support, the right mindset, and these proven supplements, you can change your story, your performance, your energy, your confidence. It can all go to the next level. And if you're serious about becoming the kind of man she dreams about, hit that like button, subscribe, and share this video with someone who needs to hear it. Your next level starts today.